Good morning, Milan. Thank you very much for taking your time out here this morning. Please tell us a little bit about yourself and your position here.
Okay. Well, my contact center experience, I've had 11 years. I started in technology industry, the Sutherland Group, that was international outsourced company. I then moved into a position as assistant vice president with the student loan corporation at Citibank, and was there for 6 years. And as the industry was starting to fall apart and we're downsizing, my unit got moved to Sioux Falls, and so I ended up thankfully at a great facility called the Unity Health System. I now am director managing the contact center operations, as well as I have a manager managing the switchboard operations, which is 24/7. While at Unity, I was able to get work toward a green belt in Six Sigma, and it's come in handy with the health reform coming on board. It's really given me an avenue to start looking at process improvements and being able to get ready for the health reform.
Excellent. Well, let's talk a little bit about the industry. What, in your opinion, are the big three trends in the contact center industry over the next 36 months?
There's more things involved with the contact center, but I believe the three trends: one is integration within the hospital if they're not there yet, meaning their current role needs to expand so they get part of the clinical piece, the operation piece, and marketing. So all three are coordinated into the contact center. They're going to need all three as the surge of people getting insurance increases with the health reform. The second one is the challenge is of staffing, because it's a unique industry. You can't staff with somebody who just has contact center experience. You need that nurse, that medical technician. They come at a higher price, and as a result, you need to beware that the quality of candidates is important. They have the experience. You can't just give away health information without knowing what you're talking about. There are HIPAA regulations. There's things that we can do and can't do, and it takes a nurse and a medical technician to do that. And I think the third area probably is in the social media, that right now the average age group at Unity is around 55 or older, tend not to have the social media environment. They don't text, they don't do live chats, and not all of them, but most of them don't. But that's changing, and so the call centers need to open up their avenues in which they could reach out to customers either proactively or through some kind of social media.
Okay. Within your particular sector, how are those sort of trends going to affect both the organizations and the vendors themselves?
It's gonna have a positive impact if, assuming we're ready to take it on. But we are already looking at social media as a footprint. It's really not a tool in which we know we're going to count on getting X amount of new patients every month, but it's a way to, I guess, be competitive with the other hospitals that are going to be doing social media, to make people aware of what Unity has and what it's capable of doing in the community.
Good. What parts of the social media does your organization engage with now, and what sort of form does that engagement take?
Right now, we obviously use the phone, not as a social media. We have the ability to text, but there's a cost associated with our system, and we can't justify the additional expense of a text avenue to our patients, because we're not getting a lot of people saying, "Can we text you?" The social media piece is slowly building up, but it's more of a marketing piece than a contact center piece. But as we move into the middle and end of 2014, we need to be in position with social media to do something like a live chat, or do some active Twitters to solve problems. Have it an avenue where if somebody's on Twitter and has a complaint, we can look at it instead of waiting for the patient to call us and say, "I have a complaint." We can reach out to them and say, "We read your complaint, and here's what we're doing about it." So.
Excellent. In terms of a general sense, how do you see social media affecting the relationships between organizations and their client groups or interest groups, for instance, around the issues, for instance, of organizational transparency or accountability to prospects or even shareholders?
That's a good question. Not really clear. I don't know yet. Yeah, I can't answer that. That's something that I'm not real confident in responding to.
Not a problem. Milan, I want to thank you very much for your time today, and good luck at the conference.
Same pleasure. Pleasure
Thank you.
meeting you. Thank you.